So it's important to also have a conversation with them and not neglect them. We would have to break it down in as simple language as possible. There is a global crisis. There's a problem. There's a big germ worldwide, and it's causing a lot of problems. It's causing people to be sick. And for that reason, we need to stay at home. We need to reassure the children. We need to educate them, answer their questions. Children can ask you over 1,000 questions every day, but don't dismiss them. Don't push them away. And then children also react differently. You may notice that at this time that a child is becoming more clingy, more unduly irritable, not wanting to sleep, not wanting to eat as regularly as they have. It's important for parents to be very sensitive to the changes in children. Talk to them, reassure them, encourage them. We are in this together. We're going to be strong as a family, and whatever it is that you're feeling, please let me know. If you have bad dreams, talk to mommy or talk to daddy. So, that's how you can help children, because to be honest, they're a population that should not be neglected at all, and that their questions must be answered by a responsible adult who is also very well informed, which is why, the focus may appear to be on the adults, but that's because the adults need to also listen to credible news to give children responsible information.
On a lighter note, I've had friends call me and say, Guy, in the last 1 week, I've had my kid call, I've heard daddy over 1 million times in the last 1 week. And then for married couples, you've heard honey, sweetie in the last, much more than you've ever had in the last 5 years of marriage. But then it's important that we'll begin to look at how we could deal with this stress. It's a form of stress for some people and for a lot of people as well. Take us through a few steps, a few healthy steps to dealing with this stress pattern at this point in time.
Well, so the first thing I would say is focus on what you can control. There's so much going on around, but there's only so much you can control. For instance, you can't control the rising numbers, you can't control how many people die, but you can control how you protect yourself, how you stay home, and how you encourage your family and friends to also do the same. I would also say that we should observe all precautions, safety precautions, the washing of hands regularly, not touching our faces, sanitizing with alcohol-based sanitizer, respiratory hygiene, coughing in our elbows or coughing on tissue paper and then discarding, and then, of course, washing hands. It's important to verbalize how you feel and reach out for professional help when it is needed. And then itemize your stressors and learn how to cope. We should emphasize at this point that people should cope more adaptively than maladaptively. A lot of people, when they're going through stress and they don't know what to do, are likely to want to use substances of abuse, alcohol, and other illicit substances to want to cope. It's not a great time to use any of those things. If you have any symptoms that you can't understand, it's important to reach out to talk to somebody. So it is a time that people will need a lot of professional help, and it's important to reach out for this professional help. A lot of people may not have the requisite skills, resilience, being able to cope in a time of difficulty. It's time to, be able to take care of yourself physically and mentally. Sleep well, eat well, relax, do some exercises. But of course, if any of and all of these don't appear to work, reach out to a professional.
Talking about professionals, I mentioned children earlier because they're also they fall under the vulnerable group. Let's look at those on the front line, the healthcare workers. These are people that face patients, hundreds of patients on a daily basis concerning coronavirus, and they are professionals in their own rights. But I'm wondering how much it's going to affect their mental health. Once they leave the hospital to their homes, those that can't touch their children or their parents. How is this affecting them, and how can they take care of themselves mentally as well?
Well, because they're humans like us too. I'm on the front line, even though I'm not on that front line. But I imagine, every day I'm getting more calls than I have gotten in a very long time. So, like your co-presenter said, people are hearing daddy, mommy, honey, more than they've ever heard in their lifetime. I'm getting much more phone calls. I'm getting distressing phone calls from people. I can then imagine the people who are working on the close front lines with people infected with, COVID. It's a difficult time, especially because they also need to take care of their own mental health. And I'm hopeful that, beyond being professionals ourselves, we can also reach out to other people, other professionals like ourselves, whenever it is that we find that we're not doing as great as we should. Of course, we would expect that, they will take regular breaks. They will be catered to as well. So beyond the general population, the healthcare workers are also a direct contact with the people who are ill, and they also need a lot of support. They also need, a lot of encouragement along the front lines. Their families also need to be carried along. We're hopeful that, someone at home will be able to cater to their own children. So for instance, when I need to go out every morning, I'm grateful that at least I have my mom around to help me take care of my own children. I can imagine if she wasn't here, what would I do? I can't take them to work. I can't stay at home. So it's about creating a balance, taking care of your own physical and mental health, and being able to understand, whenever you have signs or symptoms that show that you are, you're being overwhelmed or that you are getting burnt out. At that moment, it's important as a healthcare professional to take care of yourself, because if you don't, then you can't take care of the teeming population who would then need your help.
Very well said, Dr. Abiri. Let's move it a little bit further. The issue around stigmatization. It's a good thing that once anybody tests positive to coronavirus, except they decide to show their faces, it is kept a secret until they decide to want to expose that. But then the truth be said, there are still some stigmatization around COVID-19. People are not even free to expose and say, I am positive or I need treatment. How can we begin to move away from this stigmatization to reality?
Well, so, it's painful, but it's not unusual to find that, people are still at the level of, stigmatizing or discriminating against people who have COVID-19. I can understand their fears. I can appreciate how it is that they feel. They're probably afraid, to be associated with, or they're afraid that, well, this person may not exactly, be fully cured of whatever it is. But the truth is, many times over, when HIV/AIDS came, when mental illness became a major topic and is still a major topic, we've always said that stigma and discrimination are likely to kill even faster than the virus. If people have the right information, they have access to the right information, it's a condition that can be managed, can be properly treated, and the person will recover. All that people need right now is for us to, give them all the love, care, and support as they go through this difficult time in their lives. Stigma and discrimination is not what they need. They need love, they need support, they need encouragement from all of us. So I think it's important that people understand that it's an illness like any other illness, and that if it is well treated and attended to, whoever it is that has the virus can be managed effectively. Stigma would also, and discrimination, of course, would also affect help-seeking behavior, which is why maybe some of the reports that we've heard about people running away from Lagos or running away from isolation centers has also, been in the news. If people, were more, accepting of this illness and the fact that these people actually do need help, then people are more likely to have stayed in those centers and gotten better. It's important to, talk about the Lagos State government and how, effectively they have been able to attend to this issue. Our numbers of deaths have been low. They're working very hard. But like I said, it's important that the general population knows that if they continue to stigmatize or discriminate against people, it would affect their health-seeking behavior, and people are likely to die if they don't reach out for help, especially if they're symptomatic or if they are positive with the virus.
But I want to address the issue of paranoia, where people think that once they cough, they might have the virus.
The truth is, one single symptom is not diagnostic of the virus. One single symptom, especially if you don't have all that is on the checklist, is not diagnostic of the condition. It's normal. It's entirely normal to feel anxious, especially because, the symptoms are regular or everyday symptoms. Cough, a cold, body aches and pain, probably a headache, difficulty breathing. If, for instance, at this point, an asthmatic patient presents to a hospital, chances are they're likely to think it's corona first before they think it's an asthmatic attack. But it's important for us not to just, juggle up the symptoms and say, oh, because you're coughing, because you have a cold, it's likely that you have the virus. All other, risk factors, such as travel to an affected area, contact with someone who may have had the virus, are also other things that we need to look out for. So it's important that people don't just isolate symptoms and then start to make a diagnosis just because they feel like one symptom is enough to make a diagnosis.